Okay. Welcome, everybody. I'm Anna Cook, and I'm on the New Hampshire School Nurse Board, and I help to coordinate the webinars. And today we have Pamela DiNapoli, and she's going to be speaking on New Hampshire School Nurse Association Legislation and Advocacy. We're going to ask you to put your full name in the chat to receive your certificate of attendance. You will get it by email. And so Pam is a retired associate professor of nursing from the University of New Hampshire, where she coordinated in graduate programs and taught undergraduate pediatrics, introducing all of her undergraduate nurses to school nursing. She is currently the president of the New Hampshire School Nurse Association and is an active member of the New Hampshire Nurses Association Commission on Government Affairs and frequently testifies in front of the legislature on relevant nursing bills. She practices as a per diem school nurse in Manchester School District and is an adjunct faculty at Elms College in the online master's in school nursing track. So we're really fortunate to have Pam here, the expert on this. So thank you, Pam. I'm going to hand it over.
All right. Thanks, Anna. So like she said, I'm Pam DiNapoli, and tonight's presentation is on legislation and advocacy. And that pretty much sums up what I'm going to talk about. So at the beginning of the presentation, I'm going to talk about how to get involved in legislative activity, and then what is advocacy. And then we'll talk about some bills that the School Nurses Association has prioritized for this legislative session. So one of the most important things I think about belonging to a nurses association, your professional association, is your ability to influence policy. And that's through getting involved with legislation and advocacy. So the New Hampshire School Nurses Association and the National School Nurses Association, as we're now unified, are your professional associations and your vehicle for being involved in this process. So why nurses? Why is it important for nurses to be involved in this process? Well, one, we all know that nurses make up the largest segment of the healthcare workforce. Nursing, I never go to a single presentation where it's not pointed out that nursing is the most trusted profession. And I think this year it's something like 23 years in a row. So people listen when nurses talk, but nurses routinely don't use the power that's given to us through our professional associations and our ability to get involved. So hopefully when you're finished tonight, you'll at least get involved. Just think about one bill maybe that you'd like to advocate for that's important to you. And let's just begin to get our voices heard, given the power and numbers that we have. So when New Hampshire School Nurses Association looks to what bills we want to get involved with, what legislation, we look for bills that are going to impact nursing, patients, and communities. So we tend to look for bills where we can really make the biggest impact. Some of those are just small bills that affect our profession, and others are really large bills like the vaccine bills that are going to affect our patients and our communities as a whole over time. So when I do a presentation, I don't like to go to the website because I don't like to fumble around. So I have a lot of still shots about what I'm going to talk about. If you wanted to follow along, the website that I'm going to be going through is www.nh.gov. And then you want to select the government tab. And then when you select the government tab, you will get an opportunity to select the legislative branch. And then you're going to select general court. And that's the websites that I'm going to take you through. This picture, this is the Golden Dome. Hopefully you've seen it as you're driving 93 North or 93 South. And this is where the Senate does all of their legislative activity. Across the street is a building called the Legislative Office Building, and that's typically where the House does all of their business, except for this year it's being renovated. So the state has rented a complex called Granite One. If you're from Concord, you might remember it as the Liberty Mutual campus. And so this legislative session, should you choose to testify, you would go to the State House for Senate bills and to Granite Place for the House bills. So just to start, so when we talk about the legislative body, we're really talking about the general court. So New Hampshire is very unique. So we have 400 representatives. So that's the House of Representatives, and we have 24 senators. So we are the second largest general court in the United States, following the U.S. Congress, which is the federal. So the federal Congress represents the entire country. New Hampshire has a legislative body that's almost the exact same size, and it just represents New Hampshire. So the U.S. Congress and the British Parliament are two of the bigger legislative bodies, and you can see how that really doesn't compute. So we call it the citizen legislator because there's so many people in the legislature, and they're not politicians. And one of the things I'll talk about later is really the difference between politics and advocacy. So these people who have been elected to the legislature come from a variety of occupations. So we see people, we fortunately have two nurses now in the House. The thing when I say fortunate is that all nurses don't think the same. So sometimes we think that's good. We have a nurse in the legislature and we'll use that person as an advocate. But so one of the most outspoken individuals against vaccine mandates is currently a nurse. So we have to look at the backgrounds of these people, and you have to really get to know who your legislator is, and then you want to work towards the strength. So is that person, we have several physicians, is the person a former educator? So these individuals get paid $200 per term, and a term is a 1 year term, a 1 year of a 2 year term. So they make about $100 per year. They essentially work, a term starts around, we just started this legislative term, and it started around January 15th, and it'll probably end towards the end of May, beginning of June, depending on how many bills are left to be voted on. So they really don't get paid very much. And so that's the citizen legislator. And they're typically, many of them are retired professionals. So currently in the general court, in the House of Representatives, we have 220 Republicans. We have 177 Democrats. We have one independent, and there's one vacancy. One of the chair of the Education Committee in the House recently moved out of state, and he was a good advocate for some of our nursing legislator. So we will probably miss his presence there. Many of the despite having a political party, many of the people also have affiliations. So some of them are called free staters, and those are people who tend to really think small government is a good thing. Some of them are very radical. So you have to again look beyond the political party and look to see what their affiliations are. Within the Senate, the Republicans, we have 16, and the Democrats, we have 8. So one of the things that's important about these numbers is oftentimes bills are voted right along party lines. So, sometimes some of us get jaded by votes because you think that you give a really good evidence-based testimony, and when it comes out of committee, it comes out on party lines. So we're always working in our efforts for advocacy. We're always working to see how can you sway somebody to vote across party lines, what they typically call across the aisle, or a bill that's nonpartisan, so that you can try to avoid that split that's going to kill a lot of your bills just based on party lines. So it's important to know who your legislators are, what their party is, what their background is. And then when you're contacting them, you can begin to use that information to your advantage when you're advocating. So we're going to go through now step by step a process of how a bill becomes a law. So it's a long process. And when I say long, it's long by the year, and it's also long in the number of years. So many times you'll see a bill that was introduced in one session and it comes back year after year, and maybe on year 6, it finally passes. So advocacy takes a long time. And if you think about elections happening every 2 years, you have to think of the chances that a bill that came up in the previous session may get overturned based on just on the makeup. So we call that the midterms. So when you have a midterm election, it could turn your entire bill into being defeated to being passed. So the process starts with what are called legislative service requests, or LSR. And I think it's important. I know this is dry information, but it's important to know the vocabulary and how things work. So a legislative service request is a request to have a bill drafted from a representative or a senator. So if you have a good idea and you either know a representative or you know a senator, you want to contact them and tell them what your good idea is and ask them to become a sponsor of that bill. So one example is that several years ago, we had a bill where it was around workplace violence. So it came out of Frisbee Hospital, where one of the security guards was shot in the parking lot. And somebody from the hospital went to the representative and said, look, this is happening in your district. We need to have a bill that protects healthcare workers against workplace violence. So he said, good idea. He sponsors the bill, and then you try to get co-sponsors. So the more people that you have to sign on the bill, the more strength you have on beginning to pass that. So all the senator or all the representative has to do is to give the good idea to the legislative. There is a group of lawyers who will then draft the bill. So they draft the bill and they give it back to the representative and the senator and say, is this what you mean? And then the representative or the senator will sign off on the bill, and then it gets a bill number. So once the bill is drafted and it's given a bill number, so it moves from an LSR, which is just a generic number, to a bill number. And the bill will be either an HB number, meaning it's being heard in the House first, or an SB number, which means that it's being heard in the Senate first. So it's introduced, and then there's a process where all the bills are then referred to a committee. So if a bill, a lot of the bills that typically nursing will be interested in go through the Health and Human Services Committee. So in the House, it's called the Health and Human Services Committee and Elderly Affairs. And in the Senate, it's just called the Health and Human Services Committee. So once it's referred to a committee, all bills have to have a public hearing. So that's your first opportunity. So one opportunity to get involved is to have your good idea, approach a legislator and ask them to sponsor the bill. Then the bill is drafted, it's been given a number, and then it's referred to a standing committee. So again, often Health and Human Services. Every bill has to have a public hearing. So that means that they're scheduled for hearings will come out the week, like this week on Monday, the calendar comes out and it tells you all of the bills that will be heard that week and in what committee. So you're interested in House Bill 100, and House Bill 100 is being heard on Wednesday at 9 o'clock in Health and Human Services. So you want to be at now it would be Granite Place, in the committee room, ready to testify on HB 100 at 9 o'clock on Wednesday morning. The bills that are given a time, so say HB 100 only has one person who's going to testify, and they've given that bill a half hour. So the next bill, HB 101, is to be heard at 9:30. They can't start the hearing until the time that it was scheduled. So they can go over. So you could have HB 100 and it was given a half hour, but the testimony lasts 3 hours. So it's very unpredictable in terms of time. The only time that you know is if it's given a time, it can't start before that time. So you get to your committee room and then you will sign what's called sign in. So there's two ways to sign in. You either sign in that you want to testify, or you sign in just in support or opposition. So there's usually for the House, there's a blue sign in sheet, and you sign that you are just in support or opposition. And it'll ask you, who are you representing? So you could say, I'm representing the School Nurse Association, or I'm representing myself as a public member. And then they count up those numbers, and that is supposed to be influencing the vote. I'm, again, jaded, not always sure that it comes out that way, because we've had some bills that there'll be 1,000 people in support and 4 people in opposition, and it'll still be opposed. So, again, it's a roll of the dice, but it doesn't mean that you shouldn't get involved and try. The other way that you can get involved is through remote sign-in. And the remote sign-in process really kicked off, obviously, during COVID. So they had to have a way that people could still testify and still sign in without having to appear. So I'll go through that process in a minute, but we send out, New Hampshire School Nurses Association, when we find out what bills are being heard that week, we'll send out an action alert, and we'll say, these are the bills that are being heard this week, and here's the link to sign in. And we ask you then just to go in and sign in your opposition and support. And again, they're supposed to be counting it up to look and see what is the public, who they represent, feeling about this bill. If you have a story to tell about the bill, you can write that up and submit it, as a PDF file, and they have to read all of that. So that becomes part of their testimony. So they collect all the testimony, you go and you testify, and then you give them a copy of your testimony, or you write your testimony, you submit it online, and then they also get a copy of that. And then they're supposed to go through all that testimony to help them make their decisions. And the third way to get involved is that you can actually email specific committee members. So if you have a person who hasn't made up their mind yet, it's a really good idea to select those people and do directed emails or phone calls to those people, because then oftentimes they will call you or they will email you and ask you for more information. So remember that these people are citizens like ourselves, and they may have no background in health and human services, and we're asking them to make evidence-based decisions. So what you want to do is you want to try to find the people who may not have that background in health and human services, and call them or email them and say, I'm a nurse and this is what I think. And then a lot of times they'll call you back or they'll email you and say, could you answer this question for me? So the Senate is a very similar process, but you can't submit online testimony to the Senate. So what they ask you to do instead is to email all of the committee members. So the difference between the House link and the Senate link is, on the Senate sign-in link, it will say submit your testimony to all committee members. And there's just a link that you'll put in, and it'll bring up your emails page, and then you just submit your testimony that way. So after a bill has a public hearing, either in the House or the Senate, then they vote on it. So they could either vote on it right there. This is called the executive session. So you'll hear people say they're going to exec a bill this week, which means that just the committee will begin to talk about it, and each side will try to convince the other side. And if there's close to agreement, they might have a work session where they'll bring the committee members together, 2 or 3 of them instead of the entire committee, work on a compromise bill, and then bring that back and vote on it. So the work sessions and the executive sessions, they don't accept more testimony from the public, But if you're there and they have a question, they can ask you the question. They just don't ask for more testimony. And oftentimes at those committee work sessions, individuals from the state, say the Department of Health and Human Services, may be there to answer questions. So if you work for the state government, you are prohibited in that capacity to give testimony, but you can be there to answer questions. You can always give testimony in the capacity of an individual public member. So if you work for an agency that says that you can't testify, you as an individual always can have your individual rights to testify. So when I said I don't like to go through the showing you the website, this is what the website will look like. If you go to that nh.gov website, you are going to see a website like this. And then depending if you're looking for a House bill, an HB, or a Senate bill, you're going to click that that link, and it's going to bring you to the House calendars and the Senate calendars. So you can see down here too, when you get to this, there are some quick links. So if you wanted to contact a representative or a senator, if you clicked on either one of these links, it'll give you an alphabetical list of all of the representatives. It will also give you a map of New Hampshire. So you can click what your district is, and then that will bring up who your legislators are for your district. So remember, there's only 24 senators, so they cover a much larger geographic area. The representatives, you have each representative may be representing 8 people. There's that many of them, so they often like to hear from you. So when you get to that Gen Court website and say you click House or Senate, this is what I was talking about when I'm talking about signing in. So these are going to be your choices. So I want to sign in and give online testimony to the House members. And it'll take you to that link. You upload your testimony. Either there's a type box, you can type it in right there, or you can upload a document. If you upload a PDF document, that comes to the top. That gets saved first. So that's more likely that the representatives will see a PDF document than they'll see if you just typed in the type box. Then you have the opportunity, you can click on View House Line Online Testimonies, so you can go and actually look and see what other people are submitting for testimonies. So you can see, how many people are in support, how many in oppositions, what are some of their arguments. And if you were going to testify in person, it's good to do that, because then you can kind of counter an argument. If you know that the majority of people who are going to testify that hepatitis B shots should be eliminated, and it's because hepatitis B is primarily sexually transmitted disease, and newborns aren't at risk, then to go in and you want to counter that offer, that opinion, by saying, hepatitis B is really protective for healthcare workers. It's primarily transmitted through blood, so that counters the argument that you might hear a lot of. And then the same thing with the Senate. So except when you go to the Senate remote sign-in, the directions are for you to submit a PDF to all committee members. So then what you want to do, you also want to know who are the standing committees. So I want to know what the standing committees are and who are the members of that. So if I know a bill is going to be in House Health and Human Services, I would click on the standing committees link, and it would take me to a place where all of those committee members are listed. So in that way, I can contact either my own legislator or somebody who I know is a friend to nursing, a friend to healthcare, and call them or email them directly to give them some information. So also on that link, what you can see is the House meeting schedule. So that'll give you the meetings for the week. They usually are posted a week in advance, and it will give you the time of the hearings and which bills are being heard on that day. And if you click the Senate link, you're going to have very much the same things. So this is the Health and Human Services Standing Committee. So this is the committee members. So on this committee, we know that over here, Gary Woods is a retired physician, William Palmer is a retired physician, and Trini Tellez is not a practicing physician, but she has a diversity and equity consulting firm. So we know those people are going to have a lot of information related to health and human services. And then we also know that there's other people on the other side of the aisle, the Republicans, who may not have that same feeling. We know that Kofalt is the chair of that committee, and he's also put in his interest to be president of the House next year. So he's really trying to influence people so that he will be the Speaker of the House come next term. So up here you can see, I misspoke. I said Kofalt was the chair, but Wayne McDonald is the chair. And then these are some other members. So bills currently in the committee, if I want to see all of the bills that have been referred to that committee, I can look at that as a way to find out what's really being heard this year. So again, some of the vocabulary. So after the executive session is essentially when they're deliberating to make up a decision. And then their decisions, it could be ought to pass, so that it gets voted out so that everybody thinks they're in support of that bill, whether or not it's to support the bill or oppose the bill, that it should pass. Ought to pass with amendment. So if it had gone to a work session and somebody likes most of the bill, but they have something to add, it could be referred to as ought to pass with an amendment. Inexpedient legislate, you're often heard as kill the bill. So if a bill goes to the legislature, so this week there was a bill heard on mandating perinatal depression screening. And that was quickly voted ITL because that's covered in other bills. And also the opinion was we need more than just screening, we need resources. So that was ITL'd right away. It can be retained. So currently, we think this bill needs work. So we're going to re-refer it to the committee, and then it's going to come back for the next year. And then the last option is interim study. So they like the bill, but it's a nice way of saying inexpedient to legislate, because they just say, let's study it. And by the time they go to study it, they say, we don't like this, and it becomes inexpedient to legislate. So after you have an executive session, what these recommendations do is they go to the full House. So ought to pass recommendation goes to the full House. The full House, they call the meetings when they have enough bills that need to be acted on. And then that'll be a full day session. The entire House or the entire Senate comes. They listen to all of the recommendations. Some of them are on a consent calendar, meaning ought to pass, and everybody agrees it ought to pass, and it just is sort of rubber stamped. And then it goes through that process. So every bill is heard in both the House and the Senate, so that if once it's heard from the House, the ought to pass recommendation is going to go to the Senate. And then the Senate is going to have the same thing, hearings. So to testify, you have two opportunities, either to testify at the House committee and the Senate committee. So once they go to the whole bill or the whole House or Senate, then it goes to the governor. So after a bill is passed, both bodies of the legislation, if they're both the same, so it goes to the House, from the House to the Senate, ought to pass. Everybody in the Senate agrees, then it goes right to the governor. If it goes from the House, ought to pass, to the Senate, and the Senate says, we don't like it the way it is, and they have ought to pass with amendment, it then goes back to the House to say, all right, do we want to accept this amendment or not, before it goes to the governor? The only difference is if it has what's called a financial note. So if a bill is going to cost the state money, it then has to go to the finance committee. And the finance committee ultimately will say, we have money for this or we don't have money for this. And so sometimes they'll pass the bill and they'll say, we passed this bill, but not the financial note. So you essentially have an unfunded mandate. But if the finance committee says it's a good bill, we have the money appropriated, it passes, then again, it goes to the governor. So it's really the finance committee to say, we have money for this or we don't have money for this. Last year was a budget year. So the state budget is a 2-year budget and all the appropriations have been made. And if you read the news, the state doesn't have very much money and they passed a budget that they probably don't have enough money to fund. So they're saying this year there'll be no new appropriations. So anytime there's a bill that says financial note for this session, it's not likely that that bill is going to go anywhere. And it would have to be retained. It would have to either be retained or it'd have to be resubmitted after the next budget session, which would be in another year. So again, every bill has to pass in the identical form to go to the governor. And if it's been amended, it has to go back to be concurred or non-concurred. And they have to, there are some bills that the House said, we're not going to waiver on this. So the bill dies. And again, it's something that you might see another time, depending on the makeup of typically the House, because the House has more opportunity to oppose or non-concur a bill. So then again, how a bill becomes a law is when the governor signs it or what's called enrolled it, and then it becomes a law. So once it's enrolled, the governor can either just let it go, which means it will pass. She can veto the bill, or she could sign the bill. And usually if it's a high profile public bill, there'll be a big signing ceremony and all of the sponsors will be there and anybody who's been testifying for the bill, and there'll be a big hoo-ha and they sign the bill. Veto the bill. So what usually happens the first week of the session, so probably happened in the middle of January this year, any bill that was vetoed by the governor comes back and they can override the veto. This year, I don't think any of the bills that were vetoed last year by the governor were overturned. But, again, it really depends if it was one governor who vetoed it and we're in the first term of a different governor, that governor could have a bill overturned. So here again, this is another quick link. So you can see the top is that bar that what I showed you when you looked at the Gen Court website. So now you want to find a bill. So you can find it by bill number. So say there was an action alert went out from the School Nurses Association and the bill number was HB 100. You put that into the current bill number, search it, and you'll get the text of the entire bill. So that's how you find a bill. If you don't know the bill number, which usually you don't, then you can do a quick search and use search terms. So you could put in immunizations and you'll get all of the bill numbers that have vaccine either in the title or the text. So if you have something that that you're looking for, then I usually find that I find it easier when I do a text search. So here's an example. So once I find this is a Senate schedule. So I find out what the Senate schedule for the week is. So this happened to be the schedule for yesterday. So it went to these bills were of priority interest to the School Nurses Association. And yesterday, all of these bills were heard in the Senate House and Health and Human Services. So you can see SB 429, that's a hyperlink. If I wanted to know more than the title, I would click on the hyperlink and it would take me to a bill that the title is Relative to the Placement of Trauma Kits in Public Schools and Making an Appropriation Therefore. So the testimony from this bill yesterday was about, I don't know if anybody has Stop the Bleed kits in their schools, but this bill was to mandate that all public schools have Stop the Bleed kits. And they calculated what the cost would be for all of the schools to have it. And it was fairly nominal because a lot of schools already have them and they're not that expensive compared to the risk of trauma in the schools. So that's a bill where I said appropriation is not likely to be passed. This one, it was a risk benefit issue, so that the cost of the kits was going to outweigh the risk of not having them. So that one might pass. So you can see this is what you would see if you go to the Senate committee schedule for Wednesday, January 20th. That's a screenshot of what you would have seen. So I can stop there if there's any questions about how a bill becomes a law, or how to testify or submit testimony. You can come off mute if you have a question. Okay, so then we'll go now through advocacy. So one of the things I think in the beginning when I said we have all of these nurses, but very few use that power. And I think it's because we confuse advocacy with politics. So when I teach health policy, I often hear from the students that they don't want to get involved in politics. Advocacy is different than politics. So advocacy is defined as any action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. So if I was advocating as part of the School Nurses Association, I am pleading on behalf of the school nurses in the state. So the difference with that, politics is activities that are associated with making decisions in groups or other forms of power relations among individuals. So what that means is advocacy, really the power belongs to the individual who is advocating or speaking in favor or opposed to an issue. Politics is the people that we've elected and put into positions of power who are making decisions. So how are they making decisions? Ideally, we would like to know that they're making the decisions based on our advocacy efforts, but we also know that oftentimes decisions are made irrationally. So we say, I don't want to get involved in politics, which then means I don't want to get involved in advocacy, which means that my voice isn't heard. So we have to think about the important step in this process is the process of advocating. And one of the best ways that we can advocate through politics is through elections. So, we have these midterm elections or, local elections that people think if it's not a presidential election, I'm not going to vote. But really, every vote counts, because what you're doing is you're putting people in the power to make decisions for you. So you really should be taking, at the minimum, your role from a professional association is to vote in both local and federal elections. The picture that you see, if anybody knows Nancy well, so that's Nancy's back. This is, and Paul actually is in this picture too. This was a visit to a breakfast where we met with the senators and the representatives to try to convince them about our bills. And they like to see you, and they especially like to see you when you're giving them food. So this was a conversation with one of the representatives. So how can we advocate? So you focus on your message. So the way that when you go to testify, you have 2 to 3 minutes max. So you can't go and tell your whole life story. You have to leave them with a meaningful message. So the meaningful message is something that's going to appeal to both the head and the heart. We went to testify when there was a bill that said, they wanted over-the-counter ivermectin during COVID. and it was being supported by both the House and the Senate. So it was going to go to the governor. So we met with the governor, and we thought that there was, people from the medical association. We were there from the nurses association. There was the pharmacy association, and we talked to the governor, and we told him all about the medication ivermectin and how it's not for treating COVID. And we had the best evidence-based practice message there was. And the governor said to us, that was the worst testimony I ever heard. Why would I want to listen to that science? I want to hear from the heart. And so then we gave him some information from the heart. And he said, okay, so I'm going to veto this. But just know that when you testify, we really want more than just your evidence. So that was kind of a slap to us. We're like, here we are, scientists, and you don't really care about the evidence. So what you do is you submit this brief. Again, if you're going to submit online testimony, you're going to have the opportunity to support or oppose. Then you can sign in and do that. You can call, you can write your testimony. A lot of schools do this. You may have, if you're a student recently, write a letter to the editor of a newspaper, and those are often published, and then use social media platforms. So you can send messages through social media, like LinkedIn is one that they often will look at. So here are advocacy topics. So consider, when should I get involved? I should get involved if I'm thinking about a bill that either seeks to improve health, we're health professionals, seeks to improve access to care. A lot of bills this year are related to Medicaid cuts, so that's going to influence access. Improve the safety of care. So there's some bills around staffing ratios in nursing homes. Doesn't affect school nurses, but it's still out there. It affects nurses. Anything that addresses disparities in care. So a lot of disparities between rural health and sort of urban health, and anything that helps to reduce the cost of care. So when you think about what am I interested in, and I see a bill that touches on any one of those things, those are great advocacy topics and great messages to begin your messaging with. So again, know your audience. So they need to know who you are. I always start all of my testimony by saying, my name is Pam DiNapoli. I'm a registered nurse, and I live in Manchester, New Hampshire. So that speaks to my legislators, and it speaks to who I am as a nurse. When we always say this, when nurses speak, politicians listen. So you always want to begin by saying that you're a registered nurse. I'm a registered school nurse. So if it's a school related bill, that's really important. The issue. So my name is Pam DiNapoli. I'm a registered nurse in Manchester, and I'd like to speak to you about the issue of eliminating hepatitis B vaccines. And I oppose this bill because what it means as a nurse, it puts me at risk. So the hepatitis B vaccine has substantially decreased bloodborne transmission of hepatitis. And that's important to me, who is at risk for needle sticks. And it matters to me because it matters to my profession. So I've talked to them about who I am, what it means, why it matters. And then if I have any stories, so you can talk about, so before hepatitis was mandated in, I think it was 1991, I worked with a nurse who had a needle stick, and she contracted hepatitis B through that needle stick, and it ended her career. So now I have given the audience something to think about. So now, I've given this a personal feeling, and then they might ask me questions about needle stick injuries and how often does it happen. So I have to think about what my message is and what my story is, because they're likely to ask you questions about your story. They don't always ask you questions about anything that you really said. They'll say, you may not know this answer, but, and so you can say, I don't know that answer, but I can get that information for you and email it to you later. So those are the general rules about messaging. So you want the audience to think about what you're saying. So give them that's an interesting statistic, something to feel. Oh, they're talking about one of their colleagues, and then how to act to support or oppose. This is a picture of a nurse. So this was a bill, if you can see in the back, the woman with the scarf is Polly Campion, and she was a nurse who represented the Upper Valley. So she was a two-term representative. And this young woman that's testified around the issue of providing hygiene products in all schools. So the reason that we can provide sanitary hygiene products in schools is through this legislation. So she went and she said, I can't afford tampons or pads. And so I miss school at least 1 week every month. And so what Polly Campion, who's a nurse and is a woman, she supported this bill. It was called the what am I going to call it? But it was around the issue of not having supplies when you had your that's what I was going to say, period poverty bill. So that's why we have, as nurses, we give out pads. If you work in a high school, you give out pads and tampons every day. And those girls may not be able to go to school if it wasn't for this bill. So she's a high school student. She's giving testimony. You can see she looks pretty committed, and all of these people are there with her in support. So when you do give testimony, you're often not alone. So again, the message every year we get this, we're trusted, people listen to what we have to say, but we just don't always use our voice. This is a picture. The nurse over here in the purple dress and in the blue in front of her. This is a bill that established the New Hampshire Health Professions Program, and that's a program where nurses who before may have been lost their license because of an addiction, they couldn't get their license back. And so what this bill did was to establish the New Hampshire Health Professions Program, so that if you voluntarily reported to the program, it wouldn't go to the Board of Nursing. It went to the New Hampshire Health Professions Program, and you committed to a series of drug testing and counseling and support, you could have the opportunity to regain your license. So now that program is with the Office of Professional Licensure, and there's 51 boards that they represent, and these two nurses were able to get their licenses back based on the gentleman in the white coat was the representative that they approached, and he supported the bill. So that's how the law becomes how a bill becomes law. That's about how to advocate. And I just want to quickly go through some bills that may be of interest to you. Some of these bills have had hearings in the House, but that doesn't mean you can't testify in the Senate. So look for an action alert when these come back. So there's an act, this was also heard last year, relative to religious exemption. So what they want to do, so the form that a lot of nurses use, it eliminated the need for religious exemptions to be notarized. What this would say is that all you have to do to declare an exemption is to write a note to the nurse. So it could be like, here's an email saying, I'm not going to have my child immunized, Pam DiNapoli. And you had to, in any publication that talked about immunization requirements, it has to, in bold letters, say, you have an opportunity to declare a religious exemption. So that it really, again, opens up the whole decreasing the herd immunity in the state. Relative to directing the Department of Health and Human Services to provide notice, that's what I said, it has to be in bold letters that they can have an exemption. Relative to immunization requirements for foster families, relative to removing hepatitis B from the list of diseases for which immunization is required under law. That one was heard. And again, the big argument is that hepatitis B is a sexually transmitted disease. We know that it's best given to newborns because that's when their immune system can best develop the antigens and the antibodies to fight that off. So that's the counter argument. And then relative to prohibiting Medicaid payments to facilities that discriminate employees who exercise their right to religious or vaccine exemptions. So that if you right now, so if your institution says that you have to be immunized and you choose not to, the state could revoke Medicaid payments to that organization. So that would prohibit that from happening. Some more bills that had to do with public health. Again, you can see that LSR. So that was a bill that hadn't had a number. So it would repeal all statutory immunization requirements for children. 1616 prohibits advertising. So if you go to the doctor's office and there's a sign from the Department of Health and Human Services that has the vaccine schedule, they would be prohibited to post that advertising. Relative to insurance coverage for telemedicine, this happens every year. And usually what it does is it will select at least one service. So it would be, before there was a counseling service. Now this is all telemedicine. So if you have a telemedicine service, it would have to have parity payment from the provider, the same as if you would have an in-person visit. So here's history and context. So these slides will be posted. So some of this you can read, but this would be an argument for the requirement to eliminate all vaccines. So we don't like it because it eases the process for exempting a child. We've already eliminated the need to notarize. The bill was already vetoed by the governor, so we don't see that there's a reason to pass this bill. So again, this is just, you can see how short the message is. If you were giving testimony, you would lengthen that by giving more stories, but this would be just an online submission for religious exemptions. This is a picture of advertising. So this would not be permitted. So hepatitis B vaccine, and you can see that it talks about it. You could not post this information if that bill would pass. Another bill that's, I think, of interest to school nurses, because we get this question a lot, is can I hire an LPN in as a school nurse, as a second school nurse? And a lot of times, because an LPN can't do the first assessment, a lot of what the school nurse does is triage and assess. So if the LPN scope of practice was broadened, it would make it easier for a school to hire an LPN as a second nurse, because the first nurse would be able to do the primary assessment. And then after that, the LPN could follow up and they could do increased number of procedures and have much more authority to assess. So that's HB 1030. That hasn't been heard yet, but that's one I think that's interesting to school nurses. And these are some reasons why, the pros and the cons of that bill. So if you were testifying and you were looking at the pros, you would use some of those key talking points. Some specific school health. This is what's called the YRBS bill. This was heard last year. It was vetoed by the governor. This would prohibit, or it would give students, the parent, an opportunity to opt out of any non-academic survey. So primarily they're talking about the YRBS. And if you decrease participation in the YRBS, we lose a lot of public health data. So we certainly don't want that to pass. It didn't pass before, but again, it's coming back to a new makeup of the House. One I think is interesting, and I don't know if you see this in your school, we have a couple kids in Manchester that we need a prescription to apply sunscreen. And so this bill would say that any student can bring in sunscreen, have the sunscreen applied, or apply it themselves, and establish a skin cancer prevention education program. This is very similar to having to establish a diabetes prevention education program that the DOE had to stand up this year. Extending recess. So again, this was heard yesterday, and it wouldn't surprise you that the administrators and the superintendents were really opposing this bill because of academic time. But there were some really good advocates there for really, it was really like mental health professionals who are saying kids are overscheduled and they need free time. Relative to the local school districts to provide meals, this is the breakfast meals. So this is usually every year what they want is schools to have to provide breakfast. Often doesn't pass because it's an unfunded mandate. So this one would say that schools would be reimbursed. The reason it's probably not going to be passed is the one that I said before, an appropriation. So it would be really expensive for the schools for the state to have to provide schools money for breakfast. So again, when I'm doing testimony, I want to look at the history and the context of where a bill started and where it comes. So this was the bill that would it was the YRBS bill that didn't pass, and the governor ended up vetoing it. This is sunscreen. So the rationale is the American Association of Pediatrics and the CDC think that recess is a good idea. Some pros and cons. That this was the bill of the gaps in meal access, so not likely to pass again because of the financial note. And then finally, I wanted to just give you some quick resources. So again, you always have the New Hampshire School Nurses Association, but there's also a Facebook group that's pretty active, the New Hampshire School Nurses Community Group. The New Hampshire Nurses Association represents all nurses in the state, so they usually have a legislative agenda. Legiscan lists all of the bills that you can follow. So Legiscan, you just put in your bill number and it will follow that bill. It'll send you email alerts when the bill's going to be heard and if there's any amendments. We talked about Gen Court. New Futures is a great advocacy association, and they have some priorities that are very similar to school nurses. You can register for their advocacy newsletters, and they're really good. They'll send you a form, and they'll say, we need you to advocate on this, and you really just fill out the form, and it goes right to the committees. So that's a really easy to get involved. NAMI is interested in mental health issues. So a lot of school nurses are really interested in some of NAMI's priorities. Nurse practitioners, they're a lot of really protecting their scope of practice. And then I just wanted to say, and one question that we get a lot is around, are there laws about? So there's a difference between the Board of Nursing that regulates our practice through interpreting our scope and standards versus legislating. So oftentimes the questions that we get around delegation or around different issues, they don't have to be legislated, but they have to be interpreted within the scope and standard of practice for the nurses. And the Board of Nursing typically serves that function, so that if you want to know if there's a law, you may be saying, is there a rule through the OPLC that would determine my action? So the difference between OPLC is they establish rules. The legislative branch establishes laws. So when you ask us a question, say you email the School Nurses Association, say I have a question about delegation, we would probably refer you to OPLC and to the rules of delegation. So I know that was a lot and it was long and it was fast, but we have just I can take questions online. If you have questions after this presentation, you can send them to me. We'll send out the slides after the program. And if you're reviewing the slides and have questions, feel free to send me some questions, email, and I'm happy to answer them. All right.